The draft of the 2012 state budget envisages a 5.3 million dram reduction of expenditures in the sphere of primary healthcare compared to the passing year. This was the topic at a joint press conference organized by Oxfam Great Britain and the Economic Development and Research Center. As executive director of the center, Gagik Torosyan mentioned, the reduction of expenditures in the sphere of primary healthcare foreseen in the 2012 draft state budget will not allow to ensure a level that is adequate to the level of at least the services in 2011. According to him, the government of the Republic of Armenia should revise the draft budget for the benefit of bringing quality and additional public resources to the services provided by primary healthcare experts. At the same time, the representatives of Oxfam Great Britain Armenia and Economic Development and Research Center claimed that the inflation was not taken into consideration during the preparation of the draft budget. In addition, the decrease of expenses by 300 million drams, reduction of the sum for obtaining medical equipment and accessories, was not that obvious due to an increase of amounts provided for mandatory social payments by 297.4 million drams. In addition, according to the center's project director Karine Harutyunyan, we don't view the increase in mandatory social payments as an increase in quality or volumes of provided services because it merely assumes compensation for expenses that are simply imposed. On the one hand, the government is increasing taxes through a taxing package, and on the other hand, it is allocating and charging sums for that allocation. Thus, it is proposed to increase funding for services for maintaining primary health of the population and services for specialized medical assistance at least until the level that is compatible with that of 2011 at the price of spheres that are less important than healthcare. In addition, the Economic Development Research Center recommends not decreasing the financing of dental medical care services by 390 million drams. It also turned out that the pediatric and primary health maintenance centers of the provinces are not in good condition. They lack adequate equipment, the opportunity to show professional assistance, and need to be renovated. This is the pediatric center in Acharkut, which lacks all conditions that a building should have. Unfortunately, the center is located in a classroom, and this is inadmissible because the conditions are not hygienic. Monitoring was only conducted in the Tavush province, but the representatives are certain that the pediatric centers of other provinces are in the same condition. Oxfam has appealed to the National Assembly with all these issues. According to Oxfam Armenia's Media and Advocacy Officer, Christine Hovanesyan, the reduction foreseen in the 2012 budget will lead to heavy social consequences. Studies showed that the insufficient size of the state budget doesn't allow healthcare to be at a high level, to be high quality, and it isn't affordable. We call on not allowing the reduction of allocations to the sphere of healthcare in 2012. The need for maintaining the sums in the state budget was mentioned, and it was suggested to implement reforms in the sphere, particularly the development of social packages that work quite successfully in different countries. During the joint discussion of the Standing Committee on Healthcare, Motherhood and Childhood and the Standing Committee on Finance, Credit and Budgetary Affairs of the National Assembly, in response to Member of Parliament Larissa Alaverdian's question on the reason behind the reduction of sums allocated for primary healthcare, Deputy Minister of Finance Pavel Safarian avoided exhaustive explanations and just stated that primary healthcare included 11 programs and that there had not been any reductions. There has not been any reduction of expenditures for primary healthcare. There may be fewer programs and there may be additional programs. The reasons are the possible change of the number of beneficiaries and the change of prices. Chairperson of the Standing Committee on Healthcare, Motherhood and Childhood, Ara Babloyan, mentioned, I agree that the power of primary health maintenance and its importance are invaluable. We must continue to show our approach to the creation of such structures and the preparation and advancement of specialists. If we have flaws, as the minister said, we must revise and improve the primary health maintenance because that is an irreplaceable service that shouldn't be reduced. All the details of the above-mentioned study and the proposals of the project's expert team have been discussed and taken into account during a joint session held by the Standing Committee on Healthcare, Motherhood and Childhood and the Standing Committee on Finance, Credit and Budgetary Affairs of the National Assembly. The details and proposals have also served as a basis for fundamentally revising the reduction of expenditures for primary healthcare in the draft of the 2012 state budget compared to the passing year. On December 8, the Parliament of the Republic of Armenia adopted the draft of the 2012 state budget. Positive qualitative changes will take place. If we compare the funding for the primary healthcare sector planned both in the draft of the state budget and the approved state budget, one will see that the main difference is due to the recalculation of changes in social payments. As the draft law, an increase of social payments was rejected, projected increase in expenses by 297.4 million drams was cancelled, and the increase of dental care services by 2 million drams rather than decreasing it by 319 million drams. The latter is a significant achievement taking into account the fact that if the funding of dental care services would decrease in line with not increasing funding for social payments, the overall reduction of funding for primary healthcare sector would be notably bigger, 407 million drams instead of 86.2 million drams. In addition, the increase in social payments would not lead to any positive qualitative changes, and the reduction in funding of dental care services would have a negative impact as those services had rather high demand among the population. Even though the budget cut for primary healthcare for 2012 has been stopped thanks to the joint efforts of Oxfam and its partnering organizations, the budget allocations for the healthcare sector in Armenia remain a big issue, and the civil society should continue to demand more state investments for affordable and quality healthcare services for everyone in Armenia.